Invite up our last presenter, Dr. Ann Ness, and she will take it away from here.
Thank you.
These are as a PDF, so you can, I believe you just will need to scroll with this button right there.
Oh, thank you.
Yes.
So, okay, thank you. I put the camera in the wrong angle if anybody wants to help Carol so that, thank you. Carol's here with me today. Fix that up. Oh, thank you. Okay. I take care of my aunt. Thank you. Carol Ness, and she was in a nursing home for 5 years after she had a hip fracture. I didn't really know where she was in the world before she called me from the nursing home. And in the nursing home, she gained 30 pounds in 4 years and mostly abdominal fat. And she was not allowed to walk, and they used a bed alarm so she wouldn't get up and go to the bathroom. Then when I brought her home to try to address all these problems that had developed over the 4 years in the nursing home, constipation, itchy rashes. We went to so many specialists. I'm sorry you can't see the animation of this slide, but the cat is overwhelmed with all the people coming and going. And when people have multiple comorbidities, they tend to influence each other and make their condition worse, and especially their mental health. And Carol was diagnosed with schizophrenia in 1976. So in the nursing home, her pre-diabetes became full-blown diabetes, and her chronic vascular disease created wounds in her legs that got infected, and she had inflammation. She was immobilized. Her waist to hip ratio went up. Her insulin resistance went up. Her diabetes got worse. Her chronic vascular disease got worse. She had what is CPD? I thought that was going to be coronary disease, and it all influenced her mental health. Oh, you're going to change that. So in July of last year, we did this holistic nursing assessment. I invented based on a tarot reading. You ask about the past, present, future, and challenge. And so I asked about the past, present, challenge, and future goals of the body, mind, emotions, and spirit. Oh, don't go back yet. So because she was a very spiritual person, but she had an angry story about how she broke her hip and how she was treated. Um, her emotions can really be a help to her because she likes to bond with people, and she loves her friends and her family, but they can also, so that story needed to be rewritten for her emotional health. Her spirituality is very important to her, and that is a strength she can use for healing. And so she really wanted to be able to walk normally again. And so then we can go to the next slide. Thank you. So the first unusual intervention we did was cryolipolysis for her abdominal fat to get rid of some of it. So the first treatment reduced her waist measurement 2 inches. And we used a healthy diet with half of the plate raw fruits or vegetables, 2 out of 3 meals. There was one meat congregate meal in the apartment building we moved into. That was the standard American diet that I wanted her to be able to go there in spite of her diabetes and in spite of the cakes and everything, because she could make friends there. And they had a new step machine in the fitness room at the apartment building. So she used that every day to warm up her legs and get them moving again. And Eventually, she started walking down the hall again. So, and now her waist to hip ratio, it was 44 to 39 in July of 23, and now it's 39 to 39. And we have finally got her off of the 30 units of Glargine daily she was taking. Over the year, we reduced it stepwise with her internal medicine doctor. And so now she doesn't have to take any insulin. And her A1C was 6.3. You probably didn't see on the first slide the assessment. It was 9.3 in 2019. And that's why they were giving her so much insulin. And now she walks 200 feet 1 to 2 times a day. And last weekend, she went on outings by herself. She was able to plan and schedule things, and she did very well. And here's some references. I didn't talk about all of them. I should. So people are finding that visceral fat correlates with increased insulin resistance. So that's why we did the Cool Sculpt to help her have less insulin resistance. And so the insulin she does make works. And the cryolipolysis has been studied in hundreds of studies, and systematic review found that it was safe and didn't cause elevated liver enzymes, which was something I was worried about, the cholesterol and liver being affected. So the chronic venous disease she had in her legs is completely gone now. Her legs are quite healed. They still look scarred, but I do manual lymph drainage massage. I did it every day for a year. Now I can just massage her dry skin with, oh, and I have 2 minutes. So Carol, the reason we called it, it doesn't matter at your age is because that's what they told her in the nursing home. But now that she lives in the community, we know that her care does matter. And I've helped her coordinate care with urology, internal medicine, physical therapy, psychiatry. She was getting some tardive dyskinesia on the antipsychotic she was on, and so we tried to stop it. We had weird behaviors, so we just have like a 1/4 milligram of risperidone for her schizophrenia, and she doesn't have the mouth movements anymore. So it's been a wonderful healing year, and now she turned 83 last spring, and she has hope to live to be 100 like her grandpa, and she is going to walk without a walker one of these days. Any questions?
People are going to be hiring you to be their caregiver. It sounds like you did an amazing job.
Was a partnership.
Super job. Great relationship. So as a patient advocate for somebody who doesn't have a caregiver like you, how do you or what do you recommend for people who have elderly relatives or friends who are having problems negotiating multiple conditions and those type of things when it's so hard to advocate for yourself?
I hope you can find a holistic nurse to come and help you. Or I think holistic nurses should be hired by all health systems to help create different pathways for people to get help with navigating their comorbidities. And so Carol's case manager didn't think she needed a nurse, so I didn't get paid 1 cent for taking care of her. But I think she needed a nurse. I think everybody with multiple comorbidities should have a nurse on their side.
We have time for one more question if anyone has one.
I think the work that you're doing is phenomenal. I would agree. I mean, I think the comorbidities, and we've done different approaches in that. It's called care management, have RNs helping from pediatric to adult patients. I think the part that I've always been remarked as we talk about cancer journey, talk about other stuff, is this concept of graduation or concept of when it transitions, and people don't prepare patients well for what that looks like, and or nor do we design or create for what it's ultimately, right? Like is your role there present the whole rest of their life and care journey, or how to prepare and stuff? Because this thought of graduation, it's like a finite, like when we design, it's like, oh, we'll give them this for 6 months, we're giving this for a year, and then they graduate, but then they're just left with
Right. then they
nothing,
have
right? And so,
nothing.
and then they just feel abandoned and they feel left. And part of it is because the network, the extensions beyond that. So that's what I encourage when we think of this thing is what does that look like? And I think for each patient, it'll be a little bit different, but that's what's always, again, when it becomes a challenge on resources and the other stuff is what is our next phase. I'd like to think of it as sort of calling it graduation or calling it like, how do you extend or how do you bring in other people to support in that relationship? When again, it may not be an RN that can do that in every case.
Well, they are training a lot of community health workers in at St. Kate's, and I don't know if that's something that would be an option for people who graduate from severe illness. But there was a project in Minneapolis for the Living at Home Block Nurse Project, where they had a nurse assigned to a geographic area and had a clinic, had a office where people could come and see her, or she could go out and visit people. And I think we need more projects like that, community nurses.
Absolutely. Well, thank you, Anne, for your presentation. This concludes our oral presentation session.